Okay.
Video. Okay, I'm Dr. Kevin Bethel at the Freeport Family Wellness Center. And I'm going to just explain for Melanie a little bit about what cancer is and how it develops. And we noticed just on the initial, I haven't done an exam or anything, just on the initial intake with the nurse that the blood sugar was a little elevated. It was 132 milligrams per deciliter. And granted, that is after eating, but it really shouldn't go high. But we noticed that with cancer patients, this is a common denominator, is that they have subclinical or full-blown diabetes that develops concomitantly with the cancer. And this is part of the whole mechanism of the cancer. So just quickly to understand what a cancer is, cells have a particular structure. Where the cells all fit together in a way. They have a nucleus, like an egg yolk sort of thing, and then in the cytoplasm, right, there's tens of thousands of these mitochondria, and the mitochondria are what generate energy for the cell. So without energy, just like gas in your car, nothing will work in the car, right? I mean, so the cell needs the production of energy for anything to happen, including the duplicating and replicating of a cell. And on its basic definition, a cancer cell is a cell that is your cell that has decided that it's going to replicate more than it should, and it's going to change its behavior in ways that it shouldn't so that it can grow into areas that it shouldn't normally grow. Because, like they say, birds of a feather flock together. So certain cells, the body has an organized skin cells stay on the skin, and bladder cells stay on the bladder, and ovarian cells stay in the ovary, right? They shouldn't be spreading, right? So if they start to spread, then you know, that's one of the features of cancers. But looking at cells, if this is a normal cell structure, and depending on the shape of the cells and how they're put together, we can actually look at the cells and tell, oh, this is you know, a lung cell, this is a gastric lining cell, this is a, you know, a liver cell or whatever. Or liver cells, you know. So this is when they're normal. So as they start to change, the shape of them changes in some ways, you know. So they start to lose their shape, and they don't fit together properly, right? And the nucleus is larger, all right. So the cytoplasm to nuclear ratio decreases. So there's less cytoplasm compared to nucleus, and the nucleus is darker, and there's less of these mitochondria. So this is atypical. This is precancerous. Precancer, pre-C, right? This is sort of normal.
Okay.
All right, or this other word that we use is atypical. So when you see atypical cells, you know, on a pathology report, that's just really a polite way of saying precancer, right? Now, they can be atypical because of other things, infections and things can cause them to be atypical, but we also know now that if they stay atypical long enough, no matter what the cause is, that eventually, you know, cancer cells can develop. But the mistakes that we noticed that there were mistakes in the replication of the cells that happened on the genes, which are all preside in the middle, in the nucleus, in this middle structure called the nucleus. So there's 20,000 genes in there, right, that code for everything from our hair color or eye color, and, you know, all kinds of things, you know, everything in the body actually. And, you know, so some mistakes start to be made. And the more advanced or the more atypical the cell, the more mistakes are made. But the mistakes are being made because there's not enough energy to properly do the job that's needed with the replication of the cell. So when there's an energy deficiency because of the mitochondrial dysfunction. So cancer really is a mitochondrial dysfunction disorder at its primary cause. Yes, once there are, you know, nuclear DNA, you know, changes. So once the cell becomes, you know, really irregular shaped and, you know, big giant nucleus, you know, they would look at these cells and they'd be off invading into other structures, literally like crawling around. So when they looked at these, they said they looked like little crabs.
Oh, wow.
Right? So, if I imagine if I put little eyes on there, doesn't it look like a little crab? Right? So they called it a cancer cell. Cancer is just Greek for crab.
Oh, okay.
Really?
Yeah, think of the zodiac, Cancer.
Yeah.
See, right?
Yeah.
See, so cancer is just Greek for crab. So that's where the whole name came from. But you'll see that cancer cells, full-blown cancer cells, have no mitochondria. So they can't produce energy the way that normal cells can. They can only produce energy really through one mechanism, which is called glycolysis. So that allows glycolysis is a very inefficient way of producing energy. They can produce energy quickly, but it's very inefficient, right? So that's something we can take advantage of. So if we can prevent the cancer cell from producing energy through glycolysis, by inhibiting the glycolysis process, we inhibit the cancer cells, but our healthy cells, which don't depend on glycolysis, are fine. They're totally unaffected. So part of the treatment is to get you on a medication that inhibits this glycolysis, and some very common prescription medicines that are available, and some supplements. So one of them is metformin, also known as glucophage. Very important. It won't cause your sugar levels to drop because it's really inhibiting this gluconeogenesis and the production of sugar in the cancer cells and your other cells, but without causing a burst of insulin to drop your sugar. We don't want a lot of insulin. Insulin is a growth stimulator for cancer. So by having your sugar levels be high, like if you eat a sugary meal or a very starchy meal, what ends up happening is it spikes your insulin, and insulin stimulates cancer cell growth.
Okay.
To drive that home, I usually point out to the medical students that the growth hormone is almost identical to insulin, structure-wise. It's growth hormone is 2 amino acids different from insulin. So basically, growth hormone and insulin are the same thing. And the last thing you want to do is be feeding your cancer growth hormone, right, to make it grow, right?
Yeah.
So we want to control those factors.
Through diet?
Yeah, through diet.
Yes.
Just a low-carbohydrate diet, which we'll have a handout. I won't spend too much time eating up the data on your phone with that, but we'll go over that. But I just want you to understand, what a cancer cell is, how it's different from your normal cells, and how they can take advantage of those differences in a way that can be used for treatment. And these things that I'm talking about are not an either or. They can be, looking at the metabolism of the cancer is one strategy for dealing with the cancer that we layer in along with other strategies, which don't necessarily exclude mainstream treatments, of radiation and surgery and chemo and those sort of things. And then newer therapies that we'll switch gears to, which is like the virotherapy. Yeah. So the immune system. So we'll switch gears and we'll start talking about, from my point of view, about virotherapy and where it falls into. I actually categorize it as a subcategory under immune therapy. Yeah. So there's lots of things that are called immune therapies now in mainstream cancer. You've got some of the medications and stuff that you're on, all those ones that end in A, B. Those are synthetic, to put it in its simplest terms, those are synthetic antibodies that are targeting different cellular functions in the cancer cell. But those functions are also found in our healthy cells, and so they're not without side effects, but they're way better tolerated in general than the chemotherapies, which are, to put it quite simply, just poisons that try to poison the cancer and kill them off before the healthy cells, but with a lot of side effects. So the immune system is supposed to recognize abnormal cells and deal with them when they're still in that atypical stage, or even when they're in the cancer stage. But for some reason, sometimes the cancer cells, they are able to evade the immune system. So one of the things we want to do is help the immune system be able to recognize the cancer cells as being abnormal. Yeah. All right. The analogy that I quickly make is that the immune system is like the police department in a city. So your city is analogous to your body. You've got different people doing different jobs, just like you have different cells in your body doing different jobs, right? So, And any one of those different jobs can become a criminal. There are doctors that become criminals. There are accountants. There are lawyers. There are police officers that become criminals. Right?
Yeah.
So just like you can have the immune system itself become a cancer. Right? So think of the cancer cell as like a criminal cell that's going into places like people's homes and doing things that they shouldn't do, like killing people, right?
Yeah.
So the cancer cell's like, it's one of your cells that's rogue. It's just a bad guy, and we need to round him up. So the immune cells, our healthy immune cells, are the ones that are supposed to be helping to do that. So, but just like the police officers in our real life world in the city, they have a hard time just walking down the street and just looking at someone and saying, hey, that's a criminal.
Yeah.
How do they know? A criminal doesn't walk around with a big sign saying, I'm going to go rob the guy's house down the road.
Right.
They don't do that.
Yeah.
So cancer cells are the same way. They're sort of in stealth. They look different, but the same way that we don't like for police officers to just pull someone off the street because of the way that they look and arrest them and shoot them, right? We can't have our immune system do that either.
Right.
So that's when you overstimulate the immune system, it can start attacking your own cells. So this like CAR T therapy, there's these new immune system where they mega charge the immune system. That's what happens. So sometimes people actually die in that treatment process because the immune system. Because the immune system is just like giving a carte blanche for the police department with no repercussions to pull anyone that they think is dangerous off the street and shoot them.
Yeah.
And
not recognizing the real criminal.
Right. Yeah. They just started. Eventually, we'll get all the criminals. But then they end up killing everyone in the whole city.
Yeah. Right. Killing all the good and the bad. Yeah.
So that CAR T therapy is they'll eventually, they're trying to tweak it, but back to the Rigvir. So if we could. So we know that viruses some viruses have a ability to preferentially attack and kill cancer cells, right? So you can almost think of the viruses as maybe the police dogs or something like that. With direction. Well, maybe that's. I mean, there's many ways to think of what the viruses do, but one of the things that Rigvir does is it's not a pathogenic virus. It doesn't cause a disease. It's a naturally occurring virus. But it finds cancer cells and it infects them. Once the cancer cell is infected, the immune system then recognizes it as an infected cell.
Right.
So the analogy that I sometimes use is like, when they have bank robbers and they rob the vault, there's a purple dye that will explode that they can't wash off.
Yeah.
So even if they try, the police can then find them because now they're tagged.
Yeah.
Right.
Yeah.
They're tagged.
Right. So exposes them.
So Rigvir is like a tag. So draw our cancer cell here again, big ugly cancer cell, right? So what we want to do is we'll just tag him with some Rigvirs.
Okay.
So then now the immune system is able to recognize it as being a cancer cell.
Yeah.
But Rigvir does a little more than that.
Okay.
Rigvir itself is what we call an oncolytic virus. So what it does is it actually attacks and overwhelms the cancer cells and directly kills them. But even in the cells so what happens in the typical course of a viral infection is the virus attacks the cell, it convinces the cell to start making more duplicates of the virus, which then in turn attack other cells. And that process goes on until the immune system sort of, recognizes what happened, just like the police department. The first time the bank is robbed, they go, oh, what's going on? But then after 3 or 4 banks, they get a description of what the guys look like, and they kind of figure out the mode of operatum, and they're able to set up a sting and put a stop to the whole crime spree.
So basically, it identifies.
Yeah.
The bad guys.
But exactly. So this is what the Rigvir is doing, and it's doing it in a very natural, safe way, and so that's why you don't need to take it like every day or something like that. It's a once a week, just sort of to top it up. And then the immune system gets in there, and a few other supplements that will do to sort of stimulate the activity of the immune system to get in there and clean up the cancer cells.
Okay. And why is the Rigvir more effective with melanoma than other cancers?
Well, it's effective with for one thing, the Rigvir when they were first they found that it attacks many cancers, but what happens, they did two things. They took the Rigvir in its wild, natural form, which is sort of a nondescript in its targeting, but they selectively, over the 30 years at the Virology Institute in Latvia, selectively bred a strain of the Rigvir that specifically effectively targets cancer. And the reason, melanoma cancer, and the reason, from my understanding, that they chose melanoma is because they had no treatments for melanoma until recently, with the introduction of Keytruda and Yervoy and those sort of, which are also immune therapies, by the way, in a different category. They found that basically the only thing that helps melanoma are these immune therapies, like Rigvir and other immune therapies. Is the only thing that they found, because none of the chemos, none of those things did anything for it. So they said, well, this is, you got to, it's like, where's the bang for the buck? You know,
Right.
how can we have the biggest impact? What cancer can we target? Well, there's no treatment for this guy over here, so no one's going to object to us developing a treatment for it because there's no competitor. Because let's face it, in the world today, if there's someone who has a treatment for a cancer, whatever the cancer is, and they've got basically all the doctors in the world convinced to prescribe their medicine for that cancer, a new competitor comes on, you think they're going to say, okay, well, go ahead.
No.
They're going to defend every which way they can to prevent the competitor medicine from taking away even one patient.
Or take you to court.
That's what I said. They'll do everything, including trying to inhibit the other company from doing clinical research trials by paying off officials who are supposed to approve the clinical trials for that medicine. I mean,
they're all in bed together.
I'm not saying that happens every time, but it has happened. It has happened.
I think that's why we're here today. We've done our research on our homework. Hours and hours of listening to testimonies and videos and
it does. You know, patients do have to take their health into their own hand. So that's why I think that it's always an issue to do everything that you can, you know, to utilize every resource that's available to you to get access to it. So, for example, these new medicines like Keytruda and Yervoy and stuff, they're 5 figures at least, and mid-range 5 figures per dose. So they're like $30,000 a dose. Yes.
Yeah,
it's hard to imagine, how does anyone pay for that?
Right.
I almost fell off my chair. I mean, now that there's competition, but Yervoy was one of the first on the market, you know, that got approval for treating melanoma and stuff. It was $30,000 a dose. It's not that much now; it's half the price. So, you know, but Keytruda, it's competitive, is still that range of price. You know?
And when you don't have health insurance.
Exactly. You know, I mean, you know, it's so it's a problem. You know, with even if the medicine, you know, can help people, it's who's going to get access to it at that type of price? You know? I mean,
well, I think the most important part, after hearing you say all this and taking us back with us, changing your lifestyle totally, because I realized I used to be a personal trainer for Gold's Gym for like years ago, and I was eating right, exercising, all that.